Alrighty, everyone. Good evening. Thank you all for joining our physical well-being webinar series presented by Affinity Ferrocrane. Today's topic is part two, physical rehabilitation for any age. My name is Nicholas Vitaliano, and I'm the Wellbeing Communication Specialist here at Affinity. Today's presenter is Anthony Rusumano, founder of Mana Wellness, a personal health coach for exercise, nutrition, and lifestyle. As a reminder, this webinar is being recorded, and the link to watch this presentation again will all be shared with you in a follow-up email that will be sent out very soon. And if you have any questions during the presentation, feel free to use the Q&A option on your panel, and we'll be more than happy to address them at the end of the webinar. But before we jump in, a quick disclaimer here. This information is for informational purposes only, and it's intended to provide general guidance and does not constitute medical advice. Each person's circumstances are different and may not apply to the specific information provided. You should seek the advice of a medical professional to discuss your specific needs before making any medical, dietary, or lifestyle commitments regarding the matters related to this webinar series. Affinity is not affiliated, nor do they endorse or recommend any of the reference apps, websites, or companies and/or their products or services. Accordingly, Affinity takes no responsibility for the quality or reliability of these products or services offered by these apps, websites, or companies. Thank you, and take it away, Anthony.
Awesome. Thanks so much, Nick, and welcome back, everyone, for week number two, webinar number two. I'm very excited to jump into it. Got a unique topic today, and this is going to be a fun one for me because one that I haven't specifically honed in on in a very long time. So I'm definitely excited to jump into it. We're going to be touching on physical rehabilitation for any age. And that's going to be very, very important. Of course, when we think about physical rehabilitation, we're talking about pains, injuries, and then what we're really focusing on is how to recover from those. But we're going to take a little bit of a different direction for this webinar because we're not only going to touch on the problems, we're going to talk about the gap, the major problems and how we currently treat pain and injury. And then I'm going to give you a nice little solution, a takeaway, something that you can take home with you and start thinking about an alternative. So with that being said, let's start with the problem. Let's get the negative out of the way. I always want to end on a positive. So what is the problem? What are the major causes of pain and injury and why we need to do rehab? So first and foremost, we're going to go through five causes. The first one is low/loss of bone mineral density. So this is known as osteopenia or osteoporosis. So biggest thing with bone mineral density, what we mean here is the size and the mass of our bones, right? And when it comes to bone mineral density, unfortunately, we peak. On average, we peak around 30 years of age. And after that, bone mineral density, the mass and the density of our bones is going to decrease. We unfortunately cannot increase it, but we can prevent the decline as much as we can. And that's exactly how we can reduce the risk for fractures and long term pain, right? So, this is very, very important as we age, but it also is very, very important in certain populations, like postmenopausal women, for example. So, biggest takeaway with bone mineral density with bone is that unfortunately we are going to lose bone after about the age of 30. All we can do is prevent the decline. What we do to prevent the decline, we will go through in the solution. Number two is loss or low muscle mass. So this is called sarcopenia. So you can see in osteopenia and sarcopenia, the end of that word, that penia, means low or loss of, and we're talking about muscle here. These are the big two when it comes to pain and injuries. For muscle mass, we're talking about how much muscle that we have, the size of our muscles. It's a little different with bone mineral density because we can gain muscle anytime throughout life. So when it comes to muscle, it's really never too late to make a change. But just like in bone, we do lose muscle as we age. It's called age-related muscle loss. And this is going to contribute to weakness, joint instability, and this is also how it can also lead to a lot of bone breaks because we're not strong enough, we don't have enough muscle to prevent these falls. So again, this often leads to injury and chronic pain. Third, we have improper movement mechanics. So this is just poor form during any kind of activity, right? Whether you're doing exercise or any just movement in general. This can cause a lot of strain on the joints and tissues and muscles. and your bones because it's an abnormal way of doing that activity. So improper movement mechanics can significantly reduce pain and even acute injury as well. Number four, we have we have repetitive stress and overuse injuries. Okay, so this is very, very important because when we are repeating the same thing over and over and over again, whether that's at work, during your activity, during a sport, and you're not allowing adequate recovery bouts, it's going to lead to a lot of inflammation in that specific area, and it could also lead to some tissue damage as well, some muscle and bone damage. So if you're doing something that is repeating, that's stressful on your body, right? A physical stress, and this goes the same way as a mental stress, right? Perfect example of a repetitive stress is how sometimes we can just feel overwhelmed, right? A lot of work is coming in. We don't know how to handle it. We don't take a step back to relax, and then we're overwhelmed, and then it leads to a significant amount of fatigue. So just like we can mentally or in work, this happens physically as well. All right, and then last but certainly not least, sedentary lifestyles and poor posture. So prolonged sitting, right? Again, we mentioned it a lot. We mentioned it in the last webinar or any of the webinars we have done previously. Preventing sitting time is very, very important. And prolonged sitting, or what's also called a sedentary lifestyle, can cause any of the related, right? Poor postures. It can cause low back, neck, or shoulder pain just because we are not meant to sit, we are meant to move. And actually, when we move more, we feel better, even at a very, very low intense state. So, these are the five main causes of pain and injury for you to think about. Now, we can get into how we currently treat these causes and these pains and these injuries, and then we will jump into how we should treat them. So, this is what's referred to the gap, how we currently treat pain and injury. First and foremost, pharmacological interventions. So, for example, the use of NSAIDs like ibuprofen, acetaminophen, cortisone shots. These are very, very common today to manage pain and inflammation. Right, we're all using them. Where if you feel any headache, you feel pain, or you know you're about to go through some significant pain physically, you will take either an Advil or a Tylenol to try to reduce that pain. Does it work? Yes, it does. But for example, if you are using a NSAIDs to reduce inflammation, well, a lot of that comes with physical stress, is positive physical stress, right? Physical stress that's going to lead to an adaptation, to growth, to development. If we are taking an anti-inflammatory, our body cannot go through the natural process it's supposed to go through to drive blood to that area, to allow it to heal on its own using white blood cells. All of these natural things that the human body is so unique to having will not have as much as an effect if we are using an anti-inflammatory from any pharmacological intervention. Number two, physical therapy, right? Physical therapy is an awesome way to treat pain and injury. This includes just working with a licensed doctor to go through manual therapy, exercises, other modalities like using an ultrasound, electrical stimulation. All of this is the goal to restore movement and strength. Physical therapy is a really good one. We'll touch on it again in terms of how we should treat pain and injury, but definitely one we should mention in terms of the current trends. And then the last one that I've seen in the current trends to treat pain and injury is surgical interventions. So, a lot of times with severe injuries, it is going to require surgery. I have some personal experience with surgeries from sports, and it is not fun, right? Torn ligaments, fractures, you name it. But we want to make sure that going the surgical route is the right time and place for that injury or pain that you are dealing with. Try to make surgery the last option, and I like to speak on that from experience. Alrighty, so those are the three: pharmacological intervention, physical therapy, surgical interventions. These are the three main ways that we currently treat pain, right? No negative or positive set to any of these. The biggest thing here is just the awareness of what we're currently doing so that we can see what we should be doing or what we're not doing in order to really, really recover from any pain or injury. So let's jump into it. The solution. How should we treat pain and injury? We're going to go split this up into two parts. Part number one, the most important thing coming out of this webinar when it comes to injury rehabilitation is prevention. Prevention is first. Prevention is long term. Not only does this involve physical rehabilitation, but this goes with anytime we talk about longevity, health span, living the best and happiest life we can. Prevention is always, always, always first. All right, so let's talk about long term, and we'll talk about the solution for short term right after these three. So, first and foremost, prevention, we are going to be focusing on nutrition for healing. Very, very interesting, right? To relate nutrition, the foods that we eat can actually help with physical rehabilitation. And absolutely, getting enough protein is going to really help with rebuilding those muscle fibers and those tendons and those ligaments, and going to restructure those bones, right? It's going to help prevent the decline of those bones. Healthy fats are going to help with hormone regulation, which are going to be really key when it comes to growing those muscles that you're trying to prevent the injury or even heal in. And then biggest thing here come that I want to emphasize when it comes to nutrition is inflammation. We mentioned inflammation with NSAIDs. We mentioned healthy inflammation when it comes to allowing our bodies to heal from inflammation. The foods that we eat have a direct correlation with the inflammation in our body. For example, if we are eating highly processed and ultra processed fast foods, they are very inflammatory. They're rich in what's called omega 6s, which are inflammatory dietary fats. These are going to make your injury, your pain, whatever you're going through, much worse. Anti-inflammatory foods like omega 3s, so that's going to be from fish oil. You can take it in supplemental form, or just eating a diet in real clean whole foods is also going to prevent the excess inflammation coming from the foods that we eat. So nutrition for healing when it comes to protein, healthy fats, reducing inflammation, and then hydration is absolutely important. Then we have intentional movement and exercise. So, biggest thing here is a lot of people assume that when we are in pain or we are injured, to stop moving. That is not the case. I love the saying that motion is lotion, right? Motion is lotion to our joints, just as long as you are doing the right amount. It has to be intentional. So, if, for example, you're dealing with some knee pain, that doesn't mean to stop walking in general. What it means is probably to reduce the amount of the activity that caused the pain or the injury and take the intensity down and just focusing on walking. That's just one simple example. But when we talk about movement exercise, we're talking about increasing strength, right? Increasing the size of those muscles and preventing the decline of those bones. Mobility for range of motion so that you can move your joints through its full range of motion. And then blood flow, right? We need to get those things that are in our blood that cause and reduce inflammation in that area that help with healing to those areas, right? It's like a daily medicine, so we really want to focus on movement and exercise. Alrighty, and then last but definitely not least, when it comes to long-term prevention, we want to focus on quality sleep, and this goes into nervous system recovery. Sleep is of the utmost important when it comes to recovery. I mentioned it so many times. We mentioned it in the last webinar. I mentioned it in the sleep webinar beforehand. I cannot emphasize it enough. When we are actually physically recovering, no matter what, whether it's just from a little exercise, whether it's from the previous day, or it's from a severe injury, we need sleep. When we get sleep and we get deep rest, it's going to drive tissue repair. It's going to balance our hormones and it's going to lower our pain sensitivity significantly. All right, so these are the three: nutrition, movement, exercise, and sleep. I mentioned them in every webinar, so I had to, of course, slip them in here and for good reasons as well. So continuing on the solution, let's look at some of the additional things. Some of the ones that we mentioned beforehand, starting off with physical therapy, right? Physical therapy, again, like I mentioned, is a great way to fix in the short term, right? So I mentioned one of the things as one of the current trends that we're doing to heal pain, we're doing physical therapy, but It can be long term, but it is also more for early intervention to correct those movement patterns and restore function. And then you would transition that into any kind of one of the prevention and long term rehab modalities. Second would be emerging treatments. Okay, so especially with clinical guidance, but there are many emerging treatments coming out. You want to be sure that you are talking to your physician, making sure that it is right for you. But some of the ones that are out there that you may have heard of are stem cells, PRP, which is plasma replacement. Gosh, keep mixing that up. Platelet. I can't even get my words out. Look it up because I'm completely just can't even get it out. But PRP is where they actually take the platelets, the red blood cells from your blood, inject it into that pain or that injured area, and then allow the natural blood healing benefits coming from our body go to that area. That's PRP. And then we have BPC 157, which is new in the research as well. That helps with tissue repair and damage for regeneration as well. Again, definitely need clinical guidance with these. Um, Third, we have again pharmacological intervention. Mentioned that in the short term or in the previous one, what we're currently doing. The way I want you to look at pharmacological intervention with NSAIDs and pain meds is just to understand that these are absolutely a short term symptom control. Okay, these are not a long term solution, unfortunately, even when it comes to cortisone shots and those things. Reason being is because they're going to reduce the pain in that moment, but they're not helping with the actual healing of the tissue, of the tendon, of the ligament, the bone, whatever that injured site is. And then last but certainly not least, we touched on again surgical interventions. Again, another short term but also could be a long term. It's tough with the long term intervention only because we don't know any side effects that may come along, whether it's short term side effects or long term side effects with surgical interventions. Personal example is I did have to get surgery on my arm, and I'm already dealing with some long term side effects, and it is no fun. So, definitely something to think about as a last resort for structural damage, but definitely is going to have to be followed with some more physical therapy, maybe even some more emerging treatments. And at the end of the day, always focusing on what was most important, and that was the prevention right there. Alrighty, so let's jump into some of these key takeaways, and then we will open up the floor for some discussion, for some questions. So first and foremost, I want to focus on three main takeaways. All right. Number one is understanding that pain isn't the problem, it's the symptom. Recovery is proactive, not reactive. And to use every tool you have in the toolbox. So, going back to the top, pain isn't the problem, it's the symptom. When we're talking about actually recovering from any injury that you are dealing with, we have to think about it in two steps. Number one, identifying, and number two, addressing the root cause. Okay? And the root cause is not the site of the pain necessarily. It could be, but it's not the final say. For example, if you have any knee pain, it might not be anything that is in your knee causing the pain. It could be from tight hamstrings, maybe weak quads, maybe tight hip flexors, maybe an Achilles tendon that is actually injured, causing you to change around your walking mechanics, right? And we mentioned that in the movement mechanics part. There are so many things that could be causing your pain. That doesn't mean it's the problem, it's the symptom. Okay? Then recovery is proactive, it's not reactive. And that is exactly why I mention and emphasize prevention. Prevention is so important. We do not want to wait for the injury. Just like we talk about prevention with health span, with longevity, we don't want to wait for the disease to come. We want to be proactive about it. We want to build daily habits that support movement, strength, and resilience, right? We are being proactive so that when the time does come, if there are any pain and injuries that do come, well, we're ready to attack it because we are stronger, we're more resilient, and we build up habits to take us out of it. And then third, to use every tool that you have in the toolbox. Specifically, using those prevention tactics. I know it is very, without all the science and the information and the education, it's very hard to relate nutrition, sleep, and actually moving your body to therapy, to physical rehabilitation. But it is what is necessary for long term healing. It is the best, especially when it comes to a holistic approach, but best approach. And even the better part about it is you get so many additional benefits, whether it's weight management or chronic disease management. There are so many great benefits when you think about these three tools: nutrition, sleep, movement, and exercise, alongside the physical rehabilitation. Alrighty, so those are the things that I wanted to touch on when it comes to physical rehabilitation. I know many and most of us are dealing with pains and injuries today. So I'm going to open up the floor to questions. You can definitely ask some specific questions pertaining to your whatever you may be going through, but let's start with the general questions and then we can transition to more of the specific ones after as well.
Perfect. Thank you, Anthony. Yeah, throw those questions into the Q&A option on your panel and we'll get to answering them. All right, got one that just came in. We got great advice to keep moving if hurt or sore. Do you recommend stretching every day?
Great question, Diane. Yeah, so I would say it's more of a feel thing, right? Like absolutely if you enjoy stretching um and you like yeah, definitely can stretch every day. Depends on what exercises and stretches that you are doing. What I would say when it comes to stretching, especially for rehabilitation, is just be careful how quickly you do it when you are in pain or when the pain does come, right? Because a lot of times, a lot of injuries that happen, especially later in age, is a stretch and an overstretch of the muscle, right? Pulling a muscle. Well, when that happens, we want to be careful about stretching outside of that because we already pulled the muscle, we strained it, we don't want to strain it some more. So in just normal day when you're feeling good, yes, you can absolutely stretch every day. It's a great habit to build. I would so more so go by feel. When you're feeling a little tight or maybe something's nagging you a little bit, then you can jump into stretching. But definitely a huge fan.
Awesome. And again, yeah, throw those questions into the Q&A. We'll get to them. If you don't have any questions right now, you could always email them to myself or check out the QR code here and can contact Anthony as well. But we'll give it another couple minutes.
Mhm. Well, we have a question coming. Another thought that I would love to add for everyone when it comes to how to manage physical rehabilitation and physical activity together, because a lot of us may be in the position where they want to keep moving, keep exercising, but to what extent? Um, so I think the most important thing there is to understand. Again, we mentioned identify the injury, try to identify where it came from, how it happened and just focus on reducing the intensity. That will be a significant way where you can keep your body moving, especially when it comes to a just like a mental health standpoint. So just want to add that in there when you're trying to figure out how much physical activity you can still exercise, just reduce the intensity or just avoid that area. If you have a hurt knee, do some upper body resistance training. If you have a hurt shoulder, try to do some cardio or some lower body resistance.
Awesome. Looks like we have another one here. How can you rehabilitate an insufficiency fracture? I don't know if I'm saying that correctly.
Insufficiency fracture.
Insufficiency fracture, yeah.
I actually don't know that answer. Let me do a quick Google search on insufficiency, and then I can probably answer that. I'm not. Is there a way you can rephrase that question with a different word, and I can help you there? I looked it up. It's not giving me the best. It said something that's insufficient.
Yeah, if you want to throw another way to say that in there, that'd be perfect. We do have another one here though as well. Importance of supplements. For example, creatine, collagen, magnesium, so many.
So many. Great question. Yes, I would say supplements is definitely going to play a factor. And that would go under the long term, right? The prevention. That goes into really focusing on, right? What supplements are you having from a day to day to help you with, to prevent the injury, right? So, for example, multivitamin. Multivitamin is a foundational health supplement that is absolutely important. You mentioned collagen. Collagen is very important for bone structure, right? Bone health and keeping our bones strong. Um, Magnesium is going to help with physical and mental recovery, especially with sleep, right? So it's a lot of these foundational supplements that are going to be focused on creating a healthier state in your body, which is then gonna lead to that long-term prevention, preventing those uh, or helping that rehab in those injury states. But so I would say foundational supplements in general, and I actually have a list of foundational supplements. If you want, please reach out. I can send that over to you. Very important. But when it comes to specific supplements for rehab, I want people to focus on those foundational ones. Those are the most important rather than trying to get fixated with anything that's very specific to that injury.
Alrighty, we have some more in here. What is the best way to rehabilitate an old injury?
Mm. Great question. So an old injury, what I would say is it depends, right? It depends on what have you done before. If you have done any physical therapy, if you have done any strengthening for it, any mobility for it. So that would be the starting point, right? Making sure that you're managing all of those areas as much as you can. And then when it comes to that too, maybe putting a little bit more of an emphasis on that area. Say you have you had knee surgery about, let's just throw 10 years back then, and maybe some things are starting to nag a little bit more than others. Well, take a step back and think about what you have done to help strengthen and create a healthier state in the knee or wherever the area is, and then moving forward, build an exercise program or a rehab program specific to that area, right? Addressing the not the area, but the areas around it. So again, going back to the knee example, maybe you need to strengthen your quads or loosen up your hamstrings or strengthen your calves, or loosen up your hip flexors, right? There's so many different things that could be going into it. So not a true answer for you, but I would definitely take a step back, think about what you've been doing, think about what you can implement, especially from this webinar. So many different ways to go about it.
Awesome. We have one more question here. I have had lower glute pain for a couple years, preventing from sleeping on my back. PT and TENS treatment do not seem to work for me. Any suggestions? How about acupuncture?
Yeah, so again, I'm not a physical therapist. I don't have my doctorate degree, so this is coming from personal experience and personal education. So um, take this more with advice than straightforward. But what I would say is, again, taking a step back and looking at, are you truly doing enough to prevent or help with the pain? Um, Again, a lot of these treatments that you mentioned, that we mentioned before, they're short-term treatments. We need to focus on the long term, right? I know I mentioned, I keep saying about nutrition, sleep, and movement exercise, but you truly want to take a look at, is your nutrition, I don't want to say free, but primarily free of inflammatory foods, right? Are you moving your body not only for long-term health, but for your injury prevention health? Um, and then are you really sleeping enough? Are you getting 7 to 8 hours of true sleep? Right? Usually these are the biggest things. I don't have any short-term suggestions other than really strengthening the glutes, strengthening your quads, hamstrings, hip flexors, stretching all of those areas as well, lower back, core, strengthening your core. All of these things that we should be doing for a long period of time can go into it. Again, if you need specifics, you can reach out to me, send me an email. I can get a little bit more information and help you out there. But it really comes down to taking a step back, asking yourself if you're doing truly what is needed to be done and if not, executing on that.
Awesome. Well, that looks like all the questions to today. I'll actually, oh, one just popped up. Best exercises for good posture.
Oh, great question. Great question. This is awesome. And actually, some that I do in our in-person training sessions, I focus a lot on exercises for good posture because most of us are sitting at a desk, hunched over in front of the computer for the majority of the day. So when it comes to posture, right, the biggest thing is our actually the position of our shoulders and our chest, right? Most of the times they're going to be caved inward, which means your shoulders are coming towards the front of your body and your chest is coming closer together while your upper back is going to be spread apart, right? So that hunched over irregular posture is where we want to focus on strengthening and fixing. So, in order to do that, some exercises are going to involve strengthening it's called your rear deltoid. It's part of your deltoid muscle that's in the back of your shoulder that if you strengthen will help pull your shoulders back. Then we also have your upper back muscles. These are called your rhomboids. You have your lats. You have your trapezius. These are muscles on your back that, if you strengthen as well, are going to significantly help. So exercise specific to those, there are many out there. You can Google them. Just look at you can look up upper back or posterior chain or any of the specific muscles that I've mentioned and find a list of exercises. But off the top of my head, these are going to be like reverse flies for your rear deltoid. It's going to be like shrugs or high rows for your trapezius. It's going to be lat pull downs or regular rows for your lats as well. A lot of back and pulling movements so that you can kind of regulate and strengthening those back muscles because of that hunched over and that like kind of forward crunched position as well. So what I would focus on is look up posterior chain muscle exercises or any pulling exercises, specifically anterior deltoid, trapezius, rhomboids, or lats.
Awesome. That looks like all the questions for today, and Anthony brought up a good point. He will be at our Flemington, New Jersey branch on May 12th from 12 to 1 for a health and fitness workshop. So if you're around the area, please come and join in.
Hmm.
But for tonight, thank you so much, Anthony, for sharing all that information, and thank you all for joining tonight. We look forward to seeing you at the next webinar, Longevity, Living a Long and Healthy Life, on May 13th at 6 p.m. Have a great rest of your night, everyone.
Thank you. Have a good one, everyone.